Hi ma'am, good morning. My name is Jaidin Asmad from BSRT2C. So now I am going to demonstrate the radial pulse. But before that, I want to tackle first about the purpose, about the where we can find the site in taking the pulse. What are the normal range beats per minute? So basically, the pulse, it is a rhythmical troubling that result from a blood passing through a artery whereas the heart contracts. So the purpose it is to obtain the estimated heart action per minute, and for the possible site in taking the pulse, it can be in the radial, popliteal, temporal, brachial, and femoral, and many more. So what to note while taking or while counting the pulse, we have to note the rate, we have to note the tension or the compressibility, we have to note the rhythm or the regularity, and of course the volume. So the normal rate per minute, from 0 to 1 month, it is 120 to 160, and for the 11 to 12 months, it's 100 to 140, and for the toddler is 80 to 120, and for the preschooler is 75 to 120, and for the adult, for male is 70 to 80 beats or minute, and for the female is 80 to 90 beats or minute. So the equipment that we need is the stethoscope, the jot down notebook, the alcohol swab, and the watch with the second hand. And now let's start and perform the radial pulse. Hi Mister, good morning. My name is Jaidin Asmad, your RT physician for today. So, may I know your name, Mister? Hi, Mr. David. Good morning. So, when was your birthday, Mr. David? So, Mr. David, the procedure that I will be doing today, I am going to check your radial pulse, and I have to touch some parts of your body. And of course, there's a lot of procedure or movement that you have to follow. Is that okay to you, Mr. David? Okay, thank you, Mr. David. So, in radial pulse, it is very important that we have to explain the procedure that we are going to perform to our patients so that they can cooperate to us. So, Mr. David, if you have any problem, just tell me, or just raise your hand if you have any concern. Is that clear, Mr. David? Okay, thank you. So for the next step is we have to place the arm of our patient on the top of their upper abdomen with the downward position. Okay. And the next step is we have to we're gonna use our third fingertips, which the three fingertips, which is the first and second, third fingertips, and we have to feel the pulse. Remember, don't use your thumb because your thumb has actually a pulse in it. So we have to find that area and lightly just touch it. Don't press it too hard, and we have to feel the bounding of the pulse. So the next thing that we have to do is to count it for 30 seconds. And if it is irregular, multiply that number by 2, and if it is regular, multiply the number by 2, and if it is irregular, we have to count it for 1 full minute. So after 30 seconds, we're done, and the next thing we have to do is we have to jot down the result. We have to take the result. The result of apical pulse, the radial pulse, and document the data. Okay, so we're done. So Mr. David, we're done, and thank you for your cooperation. Thank you.